Nollywood. Oh my goodness. No. You can't tell me this story. I was watching this movie. The movie is great, by the way, as a Nollywood fan. There were some things in the movie that as a health worker, I could not just gloss over. I just couldn't believe my eyes. Oh no. I went through the comment section and nobody was talking about the mistakes in the movie. Patient goes unconscious. Your mother has hypertension. All you do is to carry her, bundle her, just like that. Just carry her. You don't do anything. She's unconscious. You don't do anything. Don't believe what happened after they carried her, where they carried her to. Like, it will shock you. And I looked in the comment section. Nobody spoke about it. I don't know if it's because I'm a health worker, maybe I'm biased, or maybe my eyes are open to these things, but nobody spoke about it in the comment section. Everybody was like, fans of this person, let's gather here. Fans of this actor, let's gather here. Like, and as if that wasn't enough, you wouldn't believe how a nurse in the movie, who was supposed to have gotten a first class and was currently studying her master's, checked this same patient's BP. You wouldn't believe it. Don't we all go to the clinic for them to check our BPs? Don't we go for health screenings and all that? Why is it that only in Nollywood the BP check was different? Like, how? We all go to the clinic and the BP is checked in a certain way, but only in Nollywood that they check the BP this way. Now, this video is in no way undermining the work of Nollywood, of the producer, the actors, the script writers, because Charlie, I'm a Nollywood fan. Okay, I watch Nollywood movies all the time. If I didn't watch Nollywood movies, I won't be here coming to give you this commentary. Alright, I watch Nollywood movies all the time. And remember, Nollywood is the biggest movie industry in Africa, and even Ghanaians are hopping on. Okay, but this video is just for educational purposes, so that we can all learn and know what to do when we have a relative who is hypertensive, who goes unconscious. Okay, because chances are that you know someone who has hypertension. Okay, you don't need to be a health worker, but you can save a life. So I'll just bring out the mistakes and also the things they did right, because they did a lot of things right in the movie. And even at the end of the video, I will show you the cure for stress that Nollywood revealed, and it works. Okay, so you need to stick till the end to find out what the cure for stress is. Nigeria produces one of the best minds, some of the best minds in medicine. For example, there is this pediatric surgeon who performed a surgery on a 25-week-old baby. So that baby is called the baby who was born twice. Removed the baby, took out a sacrococcygeal teratoma, which is a very dangerous tumor, by the way. And when he was done, he put the baby back in the womb. And the baby was born normally and is doing fine. So these are the kind of minds Nigeria produces in medicine. So how come you can't tell me this story that this is how a nurse checks the blood pressure in Nigeria? Or maybe it's not in Nigeria, just in Nollywood. I don't know. So Nigeria doctors, please come and defend your own. So let me wear my glasses and then we can watch the video.
Let's watch this video so that I have some 1 or 2 things to tell you. Let's watch this video.
So he comes back from work, he sees that she's lying on the floor, and he calls Agatha, which is the right thing to do, and he calls mommy, which is also right. So he got 2 things right over there. Okay, but then he got angry, and then he was insulting Agatha, like, is it her fault? Okay, so this is completely unacceptable. I'm on Niger. Do you get it? So what do? First, when you find your relative or anybody you know unconscious on the floor, just follow these 5 steps. Just 5 steps. Okay, first thing, you need to scan the surroundings. Make sure that there is nothing that will put you also at risk. Okay, because we don't want a second casualty, because who is going to save the mother if something happens to you? All right, so you check, is the floor slippery? Was there anything that probably hit her and made her fall on the floor? Are there bare wires? It could be an electrocution. You don't also want to be electrocuted, okay, because you are the one going to save her life. Okay, so first you scan, check for safety. All right, second step is to make 2 calls. Step 2, make 2 calls. First call, you are calling for help. So he did right. He called Agatha for help. Okay, so you can call the ambulance, you can call a neighbor to get a taxi. Okay, just call for help. All right. While help is on the way, you will get close to the mother. Okay, he was supposed to have gotten close to the mother, got on his knees, and then also called the mother, mommy, 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 which he did, all right, but not shaking her vigorously like he was doing. So mommy, 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 you tap her, mommy, 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 checking for a response. All right. If there is no response, please don't pour water. Don't try and feed the person. Force feed the person. Put food in the mouth, put water in the mouth in an attempt to make the person drink. All right. You'll kill the person. Yes, you'll kill the person. A lot of people have been doing this, and they are the reason why their relatives pass away before they even get to the hospital. Let me explain the reason why this is so. Now, in the throat, you have two tubes, okay? One in front, one behind. The one in front is the one that air passes through, okay? And the one behind is the one that the food passes through to the stomach, okay? So that's the esophagus. And the one in front is the airway. So when you breathe in, the air goes in the airway and gets into your lungs, okay? Now, God has designed the body such that when you swallow, right, there is something called the epiglottis, okay? When you swallow, it closes so that food does not get into the airway. That mechanism works when you are conscious, but when you are unconscious, it does not work. It stops working. So if you put something in the mouth of the person, it is going to get into the airway and block the airway, and the person is not going to breathe, and you have killed the person. Do you understand? That is why we do not pour water. You don't give the person any herbs when the person is unconscious. All right. So please, you don't do that. All right. So you called, there was no response. Third step, what are you going to do? Third step, you are checking the airway. So you just tilt her head a little bit slightly and then lift her chin. We call it head tilt, chin lift. So you tilt the head, lifts the chin. You do it gently. All right. If you think she may have injured her spine, then you don't do it, all right? But if she hasn't, then you do it gently, okay? This helps to open up the airway so that, the person can breathe, okay? Or if there's something blocking, you'll be able to see it, all right? So that's the next step. You check the airway. The fourth step, you want to check for breathing. So what do? You put your face close to her face. You turn it to the side, put your face close to her face, feel her breath on your cheek, okay? So if she's breathing, you have to feel the breath on your cheek. You also listen, maybe you hear some sounds. So while your head is close to her face, you're also looking at her chest to see if the chest is rising. So up and down, okay? So that's what you do. You look to see if the chest is rising. If the chest is not rising, you don't feel any air on your cheek, that means she's not breathing. You also need to check the pulse, which is the last step, to check the pulse, okay? We check the carotid pulse usually. So right under the jaw, okay? Right under the jaw. You can use the ear and then come down here. Right under the jaw. That's where you check for the carotid pulse. If there is no pulse, you start chest compressions immediately. Chest compressions. Put your hands together like that and then do chest compressions, okay? If she's breathing, there is a pulse. You don't need to do chest compressions. You just turn her to the side, okay? We call that the recovery position. That position opens out the airway. If there is anything that is blocked, secretions in the mouth, vomitus, anything, it comes out, all right? You do that while waiting for help to arrive. Okay, and remember the chest compressions, that is when there is no breathing, when there is no pulse, you do chest compressions. So you can do about 30 compressions and then release, 30 compressions and release, all right? You want to do about 120 compressions per minute, okay? So that is it. So as fast as you can, because at that point you become the person's heart, okay? So that is how we go about it when a person is unconscious. But we are not done. They sent this woman somewhere they weren't supposed to. Let's find out. Upstairs. Bedroom. Nollywood. Oh, bedroom. They sent her to the bedroom. This is a medical emergency. Patient is unconscious on the floor, has hypertension, and you send her upstairs. Bedroom. Is it a bedroom emergency? It's a medical emergency. Now, in medicine, generally in life, okay, we say time is money, but in medicine, we say time is brain, time is muscle. Okay, time is brain, time is muscle. For somebody who has hypertension, there are certain complications, and that includes stroke and heart attack. These two are very likely in somebody who is unconscious. And if a person has stroke, if with every minute you delay in treating a person's stroke, 1.9 billion cells, brain cells, die per minute. So you're sending the person upstairs, you will kill the patient. You can't do lab tests upstairs. You can't do HCT upstairs. Come on. Nollywood, Omo Niger doctors and nurses, please come and defend this one. Okay, you can't do that. The next thing is, it could be a heart attack. We need to do ECG. You need to do lab tests to look at cardiac troponins. We need to know whether we can save the heart, because remember, time is muscle. So when we say time is muscle, it refers to the heart. Okay, and I want to add my own. If the patient is a diabetic, she could have high sugars or low sugars, and that will cause her to be unconscious. So I will say it's not something that is in medicine. Okay, this is my own invention, maybe to be added one day, you never know. Time is sugar. Time is sugar, because if the person is unconscious and the sugar is low, she can die in a few minutes. So you need to send the person quickly to the hospital. We are able to detect that the sugar is low and give her something to bring the sugar up. If the sugar is high, we are able to give something to bring the sugar down. You know, there's a branch of medicine called community health, okay? And in community health, we have something called healthy housing. All right, I remember my lecturer very well. Her name is Dr. Udofia. I hope she watched this one day. She's a Nigerian, very lovely lady. Right, so you see the Ghana Niger thing there, you did. So a healthy house is a house which is sited, designed, built, renovated, and maintained to support the health of its residents. One of the principles of a healthy house is that it protects against injuries. So tell me why an elderly person is upstairs. That's the first thing. To make matters worse, she had hypertension, was found unconscious on the floor, and you send her upstairs. That is against the law. Nollywood has to be arrested. You can't do this, okay, because she's a vulnerable person. She's elderly. Elderly people should not be upstairs. Elderly people should be on the ground floor, all right, on the ground floor. So that includes pregnant women, preschoolers. They should be on the ground floor, okay? You can't tell me that this happened and you still decided that she should be upstairs. Remember, it can occur again. The fact that it has happened before increases the likelihood that it may happen again. So she can't be upstairs. What if now it happens when she's climbing the stairs? That means she's going to fall, hit her head, and then it's going to be crazy. So please, healthy house. Shout out to Dr. Udofia. If you have hypertension, it's very important that you buy your own sphere, right? Buy your own blood pressure monitor, okay? So that you can be checking every day, at least every day, morning, evening, the same time, okay? To see whether your BPs are dropping on the medications you are being given. If it's not dropping, we call it a BP profile, all right? Where we check your blood pressure. You are supposed to check your blood pressure morning, evening at the same time. Write it down, and then you can present it to your doctor. Okay, I'm sure some of you have been told to do a BP profile, but you have not done it. You've not gone for review. Go for a review. Send the BP profile and go. Okay, so that the doctor will see it. If the doctor has to add on medications, or even sometimes reduce based on how well your BPs are doing. Okay, so please go for the review. Okay, buy the BP monitor. If you don't have money to buy BP monitor, you can go to the nearby pharmacy, go and have your BPs checked. When there are health screenings being conducted around you, you can take part in those. Okay, you can also go to a nearby clinic, just ask that your BP, they should check your BP for you. All right, so that's what you can do. Okay, so that was a good one. Thumbs up to Nollywood. So let me give you a backstory. Okay, now they met prior to this encounter where they were fighting on the road. He was driving his car, he nearly hit her, and it turned into a whole fight. The doctor suggested that they bring a nurse because the mother does not like going to the hospital, which is not a good thing, by the way. If you are not well, please, you should go to the hospital. Okay, he suggested that they bring a nurse to the house, and that nurse was the same nurse he met on the way. This is the scene where she says that she's a certified nurse. She graduated with first class and she's currently studying a master, so she knows what she is doing. Okay, and then he goes like, you can be studying masters or servants, it's not my goddamn business. That was a punchline. So a nurse who is studying her masters, who had first class, look, Naija. Or maybe I didn't see it well. Maybe my eyes, there are issues. Let me get my glasses, I'm coming. Maybe something is going on within my eyes. Maybe I didn't see it well, so let me wipe the glasses. Because this is unacceptable. Vital check is universal. So Naija, please come and remove your mouth, because this one there is wahala. Okay, let's see. Let's check. Maybe I didn't see it well. See you.
Now that the nurse is here.
It's on the arm, the forearm, and she's talking about how she graduated with first class and is currently studying her master's.
First class and currently doing a master's.
And again, see, on the wrist, look.
It's a bit high.
Now she says it's a bit high. Let me remove the glasses. Naija. I broke it. It's not broken. Let me put it here before it breaks. Naija. You can't tell me the story that you check the BP here with the BP cuff. Fine. There are sphigs, okay, there are wrist sphygmomanometers. That is there, okay. But we can't put square pegs into round holes and round pegs into square holes. We don't do that. This is not a wrist sphygmomanometer. The wrist sphigs are usually smaller, okay, with a smaller cuff designed for the wrist, okay. This one was clearly the upper arm cuff. All right, it was designed for here. All right, so I do not know the reason why it was done that way. Yeah, because if you put the BP cuff here, it will give you a falsely high reading. So you will think that the person's BP is high when it is not high. You'll be treating hypertension that isn't there because of where you place the BP cuff. Okay, so it's generally, studies have shown that it is best to use the upper arm cuff. Is relatively more accurate, all right, as compared to using the wrist sphig. Okay, but this isn't even the wrist sphig, because the wrist sphig is actually accurate to some extent, okay, just that the upper arm one is relatively more accurate. Okay, so this, your doctors, Naija, they have to come and defend this. This is not acceptable. But this is no beef, all right. It's Ghana-Naija collaboration. Remember, a lot of Ghanaians have come on to Nollywood and they're also acting. Don't worry, I'll go and do reviews on those ones too, and I'll bash them too. Okay, so don't worry. So this is wrong. This is unacceptable. You cannot do this because people are watching, and I mean, okay, all right. So the next part of the scene is where she is taking medications, and this is something that was very well done in the movie. She says she doesn't like taking medications. Of course, a lot of people do not like taking medications, but she says that, but I have to. But I have to. You see? So that's one thing that I was very happy with, because a lot of people, including you watching me, don't like taking medications. Nobody likes taking medications, okay? Your parents do not like taking medications. No one does, okay? But I always say that when I meet my patients, I always tell them that the cost of taking your medications, the cost of buying, the cost of these medications cannot be compared to the amount of money you spend when you have a stroke. It can't be compared. Okay, so buying your medications regularly, at least, yes, it will cost you, right? Depending on whether or not you are even using health insurance, all right? But then when you have a stroke, the cost skyrockets, because now you have to do so many lab tests. You have to do a head CT scan. If something is not clear on the head CT scan, you may have to do an MRI. You may be bedridden, so you have to do physio. You pay for it. You have to be in diapers, all right, because you may be paralyzed. If you are not able to speak, you are not able to eat, swallow, we have to pass a tube and feed you, all right, and that will require a dietitian coming in. That is also money. You need someone to care for you if you have a stroke. Depending on the severity, that is money. You may need to be, you might be admitted to the stroke unit. At least in Ghana, we have places where there are stroke units. Okay, we have a stroke unit where people who have stroke are admitted to. It's very expensive. All that costs is like 10 times more than, even more than 10 times the cost of your medications. So it's better to take your medications, please, please, please. And oh, you see, this is also a very good thing. She's taking her for a walk as part of her recovery process. Then she spoke about salt intake. Just take a look. She's asking the cook to reduce the amount of salt and seasoning in the food, which is very fantastic, because as Africans, genetic studies have shown that our genetics make us more salt sensitive. All right. Anytime you take in salt, your BP will go up. Okay, our BP goes up. We are more salt sensitive. So it is best to cut down on our salt intake. Whether or not you have hypertension, you can cut down on your salt intake. And if you have hypertension, it will be a very good time to employ the services of a dietitian. Okay, to help you based on your budget, based on what is available to you, to show you the foods that you should eat to help, bring down your blood pressure. So you do that in addition to taking your medications, and you see that it works. So exercise, reduction of salt, seeing a dietitian is very important. So justice for dietitians, all right? Justice for our nurses, she's doing a very great job. Justice for dietitians, justice for doctors, justice for all health workers. So shout out to every health worker in this world who will be watching this video. Okay, you guys are doing a good job. All right, and I'm doing a good job too. Yes. Okay, so that's it. Let's move on, and they go on fighting. Okreka certificate, what does that mean? Or what is Okreka? Maybe the Niger people can help us. One person is wearing glasses, the other person is not, and they are both pointing at each other. The one who is wearing glasses is protected, but the other one, the nurse, she wasn't wearing glasses, and it was a very dangerous position. Okay, if you don't take time, straight to ophthalmologist, right? Ophthalmologist is the doctor gone to medical school and now specialize in the eye. You know where this ends. You know how this ends. All right. How can you be having cramps as a nurse, first class nurse, currently studying her master's? She's sitting in the couch. Why was she sitting in the couch? Did she want him to see?
Sorry.
Was it one of the tactics Well, it worked because he got a hot water bottle and kept saying sorry. Oh, sorry. He was giving her some TLC. It's not tables, ladders, and chairs. Tender loving care. But this one, dear, I can't believe it. And this one, I'm not going to blame Nollywood. I'm sure it was all part of the plot. How can a nurse not know that you can use a hot water bottle and that will help with cramps? He's asking him, how did he know? If you have cramps, using a hot water bottle can help. If you don't have a hot water bottle, you can use a towel, a warm towel, okay? It helps. Or you just heat water, pour it in a bottle, wrap it in a towel, and then put it on your abdomen. It helps to bring down the pain. Now this is the scene where we get the cure for stress. I told you I'll reveal it to you. To know, say, to know. So this is it. This is a cure for stress. Please go and tell everybody that the doctor said this is the cure for stress. Dr. Mira said.
Spend some legitimate funds. Would you like to come along?
Legitimate funds. Ladies, let them spend legitimate funds on you and glue so that your stress levels, cortisol levels will come down, alright? So you can sleep without any issues on your mind.